What's your proudest accomplishment to date?
I think it's this organization, because what we've managed to do is we've plowed new ground. We're doing some work in an area that no one else has done work, and we're doing work that's really very much needed. And it isn't just our own perception. It's based on, you know, when we started this whole project out, I interviewed about 150 people around the country that had worked with males in one way, shape, or form, and to a person they said, hey, this is really important work. But B, nobody's doing it, and it's time that we get started on it. So I really think that I would say that what I'm doing now is the most rewarding.
I agree. The summit was so energizing to see everyone galvanized around this issue, the topic, the population that we want to make a difference for. That was great.
And the thing that was great about the summit was the fact that people came up to me afterwards and said frequently they go to meetings and they talk to the same people at every one of these meetings. And these people met new people that they hadn't met before.
Right.
And they left there really energized about doing something with the campaign.
Right. A key component of the partnership, like putting people together around adolescent young adult male health. It's really great.
So tell me something. What is your favorite quote?
Currently, it's one of Maya Angelou's quotes.
Yeah.
Try to be a rainbow in someone's cloud.
And what does that mean for you?
It's in the same way that I wanted to sort of bring someone and help a young person particularly move to a better place in their life. That sort of be that positive person, sort of encourage them, get them to make that next step, or be there for them to interact and get the support that they need to move forward. So what's your favorite quote?
Please, thank you, and I'm sorry.
Okay.
I think that pretty much captures how we interact with people. If we always remember to say please when we're asking something of somebody, always after they do it, thank you. And we all make mistakes. It's important to fess up to them and make mistakes. I think where that comes from is my early work in politics, and the fact that politicians don't say that enough.
Right.
And I think if they did say that enough, that we'd all be better off.
What lessons has your work taught you?
That maybe the hardest thing is to get people's attention for what you're doing, which goes back to the whole idea of marketing, which is a terribly corporate term. But in fact, if you can have the greatest message in the world, but if you're not able to break through the noise and get to people with that message, then it's kind of pointless. And I think that's one of the greatest challenges for our work particularly, because we have a good message. It's just a matter of cutting through the clutter and the noise to get the message out to the people that we want to hear it.
Right. I think for myself, it's really about sort of understanding a passion about working with a group and sort of how over time it really can work. You just keep working towards your goal.
Right.
And when sort of moving here for the first time and becoming the medical director of the Young Men's Clinic, who knew I was going to be here 19 years later and have a 5-day-a-week clinic for the Young Men's Clinic as opposed to a 4-hour-a-week clinic that I first came to. So it's been
amazing. It's really amazing. I find on a practical level, one of the greatest challenges, of course, for any nonprofit is fundraising.
You do a great job with that.
Thank you. We're still working on that. It's a work in progress. But in any event, there's competition for funds these days because of a lot of the foundations have cut back on the work they're doing, and their priorities change frequently. And of course, we're new, and we've got a new issue, and it doesn't neatly fit within any one of their categories. So we have to be creative about how we fashion it. So that's on a practical level. That's a big challenge. But I'm optimistic because we've done fairly well in a very short period of time.
Yeah, you definitely have.
Thank you.
If you were to impact one health problem, but it's obviously we're going at it partnership is going at it in a big picture way. But what's one health problem you'd want to affect for young men or improve?
Mental health.
Mental health.
Because so much stems from that. So many of the ill health effects stem from mental health issues. Depression leads to risky behaviors, which leads to things like suicide, which is the rate of which is 4 times that of females for young men. And I think just quality of life. That if people have a better mental health outcome and outlook, that their quality of life is going to improve. But I think particularly with young men, I mean, they don't interact with the healthcare system, period. But mental health is pretty far down on the category of what they need. And that ties in with norms of masculinity. And we tell young men they're supposed to be tough and they're not supposed to be vulnerable and soft, and mental health are one of those issues which is probably the softest. If you've got a broken leg, you go in and you fix it. But it's hard to admit that you're depressed or you're having problems. And I think that young men don't even have the language to explain what they're experiencing mental health-wise. So I would say mental health is probably the most important one for me.
Right.
And you?
That's a challenging question for me, because I sort of thinking about it from public health standpoint in the broader sense of health. I think even helping young men, we're losing young men to higher education in many ways, whether it's college education or graduate school. And that plays ultimate roles in sort of mental health and health in general as a social determinant of health. We're paying appropriate attention to making sure that girls are making strides and have been for the last couple of decades. Sometimes I've thought it's been at the detriment to young men. But instead of my idea is that it shouldn't be competitive, it shouldn't be a detriment to anyone. We should move both groups forward to pay attention to our children and adolescents and young adults equally so that they all thrive. And so the one thing is just overall to help them thrive so that they have as many opportunities as possible that then will sort of lead to better health outcomes across the board.
And when you started your work, did you get a lot of pushback from folks, not necessarily in the medical community, but the notion of it's the girls and the females that are being underserved, and we really need to pay more attention and not so much to the males, because of male privilege, is
right.
Basically what that's all
about. Yeah, it's always been a point that I've had to make. I'm not trying to elevate males, adolescent and young adult males over girls, adolescent girls, and young adults. So it's always been a very specific conversation and point to make that it's not competition. It's just if we're really wanting better societies and better populations, we need to concentrate on our children across the board, not one over the other. And I think that's really important. And so, yes, it has been, there've at times been some conversations around whether we're sort of pitting one against each other. And I struggle with the male privilege piece because I do think overall society sort of puts privilege on being male, but the groups and the age group that we're talking about in certain populations within the male gender are not particularly privileged, and we're equating everyone as privileged, and that's not quite the case.
Well, and I try to explain to people that what we are dealing with are issues that are not common to all adolescents. That is, there's adolescent medicine, the patient is the adolescent irrespective of gender. whereas females have particular needs in terms of gynecologic care, and males have something of a vague equivalent, although the problem is there isn't a structure within healthcare to address their needs, and that's really what we're about, what we're trying to do.
Right. And I think recognizing how males and females interact differently in education is also important. How we deal with young men in the justice system is equally important. And so all of those play a role in how I think the impact that we have a potential to move forward in a positive way.
Right.